Hello, friends, and welcome to another episode of 10 Minutes with TmFal. This is your host, tfal&chi, infectious disease physician. And this short one is going to be about getting ready for your medical checkup, for your medical appointment, for your checkup, whatever you call it. So this is really about getting ready and things we can do before, during, and after the visit to make your annual checkup, or more often as needed, productive, rewarding, and fulfilling. So a lot of us have, had the time where you've had symptoms, you've had things you wanted to talk about, and then you get to your doctor's appointment and you forgot. Everything's rushed, you're out of there, and then you get out and you're like, I should have done that. Or you get there and remember that you don't have your insurance card or things like that. So this is really both as a physician and as somebody who also obviously sees their physician, things we can do to get ready for that medical checkup. So this is kind of like the before, tips for before, during, and after to make the most of your medical appointment. Or as, we write in surgery, kind of pre, intra, and post. So before, during, and after. And I'll do it in 5. So 5 things to get ready before the appointment, 5 things to consider during the appointment, and 5 things post-appointment or after the appointment. So whether you're preparing for like your primary medical checkup, or you're going to see a specialist as a referral, or if this is somebody you've been seeing for a long time, or you're considering a new provider, or this is your first time kind of plugging into routine healthcare, whether or not this is a first visit, a follow-up, a routine, an urgent, an emergent visit. Is this a post-hospitalization visit where you're in the emergency room? Are you new to the practice, or are you exploring, or is it an existing practice? Is this someone you selected, a random primary care provider, or is it someone recommended to you? So there are all these things going on. Are you going for a second opinion? Are you leaving the country to get a second opinion? So this is really not around surgical procedures or elective surgery. This is more around things to do for your primary medical checkup. So, everyone should have a primary care provider, and definitely once you hit your 30s, 40s, you definitely want to have somebody that you see once a year. And for sure when you hit 50, because in addition to medical issues that may crop up, then there are age-appropriate screenings that start that you want to get make sure are on the ball. So 5 things to do before your visit, then 5 things during the visit, and 5 things after. So the first things, 5 things before or pre-visit is 1 is to write down any specific questions or complaints that you have. So just so you don't get there and you forgot what you were going to talk about, write things down, try to put a date to them so you can articulate those when those happen and when those questions come up. And if they don't come up, so you can actually remember the things you wanted to talk about. So write things down. You can put in your notes section of your phone. You can do a voice recording to yourself. You can do the good old paper and pencil. Some people have a journal that's dedicated just to their medical stuff. Some people have folders. Just write things down so you can remember questions, complaints. 2, have your medication or your medication list. So if you have access to a portal, which we'll talk about, make sure you have your medication list. If possible, if it's a new provider, a new physician, have your medications with you. That includes the prescribing physician, the dosing on the medications, indication. And by having the medication list allows a healthy discussion about why you're on certain medications, but also important as we look for medication interactions, which are a big cause of problems. So important to always have your medication or your medication list. 3 is get your old records. So if this is a new practice, new provider, new referral, make sure you have your old records. If you've signed on to the hospital portal, you might be able to see most of that information yourself. If not, you want to request referrals and get your old records printed, preferably so you have them with you. A lot of times they're faxed ahead of your visit. but it's important to have old records because that helps during that initial visit or follow-up. 4 is pre-fill any kind of forms online, verify insurance co-pays, all of those things. So do your due diligence before that first appointment. Find out about what forms need to be filled out online, what your insurance copay is, what additional information is needed, because that allows your visit to go faster and better, and also allows things to be a little more fast-tracked if you do a lot of due diligence before the visit. And 5 is to know about age-appropriate screenings and things that should be done for somebody in your age group. If those don't come up during the visit, then you bring them up. But you go into the visit knowing the things that are appropriate for your age, and that's something you can find directly on the CDC or just Google age-appropriate health screenings. So those are important things to do before the visit. During the visit, 1 is to arrive before the appointment set time. So arrive somewhere between 10 to 15 minutes before your appointment time, if possible 30 minutes before. And this is to fill out any additional forms. A lot of offices have you filling out your review of systems, your allergies, prior history, medications, things like that. So plan to arrive early to fill out any forms, complete any insurance additional information during the visit. 2 is ask questions. This is so important. Ask questions of your provider, of your primary care provider. Get clarification on tests, on blood work, on referrals. If you're not clear about it, please ask those questions. And your primary care provider should answer those questions. If they're not able to, or if they make you feel guilty for asking questions, then that might not be the right fit for you. You need to know that this is your body and you need to ask questions, get clarification. If you're going for tests, you want to know about should you be fasting, non-fasting, ask questions. 3 is discuss screenings. So those are things that come up. It should be coming up from your primary care provider. If they're not, then you want to talk about screening and is it time to do those things. 4 is confirm how you will be getting follow-up for results and tests. So when tests are ordered, you want to find out, do you do that through the portal? Is this something that your doctor's office calls you back in? Do they call within 48 hours? Do they only call if it's abnormal? Those are things that help you so you're not anxious if you don't get a call. So just knowing what the time frame is to get a call back. If you get a diagnostic test, say like a mammogram or biopsy, what is the turnaround time for that office, just so you know what to expect. It's always important. Now, 5 is be honest. This is where, regardless of whatever the issue is, being honest with your primary care provider can only serve you well. So when questions are asked about your family history, your social history, substance use, other things going on, your sexual history, it's important to be honest, because as a physician, that's how we can help the most, is knowing what is going on. Be honest about your diet, your adherence with medications. So if your blood pressure is elevated because you're not taking your blood pressure medicines, if you say you are, then the assumption is that you need more medications to control your blood pressure. And if that's done and all of a sudden you're taking 3 meds when you only needed 1, there's a higher risk of medication side effects, medication interactions. So being honest about your adherence allows us to ask why that is. And if you need help with co-pays, is there a problem with interaction side effects? So being honest. After the visit, so 5 things after the visit is to follow up and sign on the patient portal. This allows you to access your own labs, medication list, appointments, allows you to reach the office at any time because they're checking those portals and responding to you. Much more efficient than calling. Second is look up any kind of literature around your diagnosis and ask follow-up questions if they're needed. 3 is pick up your scripts. So when you have a medication or medications prescribed, please pick them up and start to take them. If you have problems with your medications, either because of side effects or tolerability, look back in with the office and let them know because you've asked about how to reach back to the office. 4 is to lock up your next appointment. So make sure you have your next appointment scheduled and you have those written down. And 5 is start, again, with your journal or diary, writing down things that have come up. While they may not be urgent enough for a quick follow-up visit, they'll be important to discuss at your next visit. So again, writing things down and then encouraging, this is an extra one, encouraging others, your friends, your family, to kind of make an appointment with their primary care provider and get their screenings and routine health maintenance done. So in summary, things that can help you as you're preparing for your medical checkup, either your annual, a new one, a follow-up. 5 things before are to write things down before that appointment so you can be articulate and know what you want to discuss. 2, have your medication list with you. 3, get old records if you're transferring to a new practice. 4 is pre-fill any kind of forms online, verify co-pays. And 5, know about age-appropriate screenings and all that before you go in. During the visit, 5 things. 1, arrive a little early so you can fill out forms and things like that. 2, ask questions a lot during the visit, get clarification about tests and other things. 3 is discuss screenings that may happen earlier based on your family history, but age-appropriate screenings. 4, confirm how follow-up will be done and how you'll get notification of your test results, the timeline, and how it's done. 5 is be honest. During that visit, lay it all out. Be honest, ask questions, and be honest about what is going on and what's happening in your life, because that would allow your primary care provider to do a better job. And then 5 things after are to follow up and sign out on the patient portal. Once you're given the link that allows you access to your records and access to the office. 2 is look up other literature around your diagnosis, just so you have a better understanding of why you're on medications. 3, pick up your scripts, your medications, and take them. If you're having problems, loop back with the office. Don't just stop taking your medications. Look back with the office and discuss those issues. 4 is make sure you've locked up your next appointments. Put them on your phone, on your calendar, in the portal, and follow up with those. And 5 is start writing things down again that will be helpful during your next visit. And as a tip, this is also a chance for you to encourage other people that you care about, your friends and family, to schedule their own primary care visit. So I hope this helped you, speaking both as a physician and also a patient. When I go in to see my physician, these are tips that help before, during, and after your primary care visit. Thank you.